Good evening, all. On behalf of AFPI CPD Group, we welcome you all for this live webinar on lifestyle medicine. I think the topic which we chose is slightly different compared to the topics which we had done in the past. So I'm sure a lot of us as a family physician are dealing with lifestyle related disease, and we encounter patients on our daily clinical cases. And today we have got Dr. Shalini, who is a consultant family physician from Bangalore Baptist Hospital. She's my colleague, and also she's a certified lifestyle medicine physician from American Board. Welcome, Dr. Shalini.
Thank you, Dr. Srividhya. Thank you, Dr.
Over to you, Dr. Shalini.
So, lifestyle medicine beyond conventional medicine. So, why lifestyle medicine? So, of course, if you ask me, lifestyle medicine is a passion. And why lifestyle medicine is important for a family physician? I would like to give my experience. So, after completion of my post-graduation, I was given a role to play in preventive and wellness unit. When I took up the role, when I saw patients with their health check reports, and I was trying to correlate we saw patients, I saw patients were coming with normal reports, but there was significant lifestyle issues. And I also saw patients who didn't have anything and randomly took a health check, which resulted in some variation in the reports. So there was some correlation. I was not able to find a correlation. When I thought over it, and I realized the best fit for that would be lifestyle medicine. So I would like to start with this. Let food be thy medicine and medicine be thy food. It says that according to the at times of Hippocrates, so the connection between the food and the health was spoken. It's not something new for us. So as we know, if I see a patient in my clinic with the reports, the first thing the patient asks me is, doctor, what diet should I follow? Could you tell me about diet? So I see a very strong connection between diet and lifestyle. So I begin my talking about challenges as family physician when it comes to health. So we see wide range of patients, as we all are known for treating patients from womb to tomb. So it could be diseases from acute conditions like infections, or it could be a chronic conditions, not communicable diseases in terms of diabetes, cancer, and so on. So I also see that there are factors like internal and external factors which could be contributing for health issues, which could be like the environmental factors, which measure the major important thing could be air pollution, and also the internal could be unhealthy diet, smoking, etc. So I see various issues in terms of social determinants like inequality in healthcare and also to access to healthcare. And not to forget our pandemic, which struck us last year, and it is still there. So what is that? So we understand there is a lot of challenges in our health system. So as I said, my talk, the dietary patterns. So fat intake, this is an alarming study where it says that from 1972 to 2000, there is a significant increase in consumption of hydrogenated fats and vegetable oils. If I had to put it in numbers, it is around 24, which has gone up to 36 grams per day in rural population, and 36 grams, which has gone up to 50 grams per day in urban population. Another significant study which talks about meat intake. So there is a significant, approx 30% increase in production and consumption of meat. As the graph says here, there is a significant increase in the production and consumption. So I would rather put it another way, saying that it could be preparation methods, like we prefer more of chicken being boiled, and we prefer more of KFC than the boiled or steamed chicken. Coming to another study, which significantly says amongst children, which was conducted, so there was an increase in simple sugar consumption. I will put it saying energy-dense food rather than nutrient-dense food. So in schools, I'm sure there is very much importance given for kids' snack boxes. So we see that in the study that more than 4 times per week, children are being exposed to consumption of simple sugars like fruit juices, which was about 51%, and sweetened beverages like 18%, and ice creams, which is about 20% increase, and the trend is still increasing. Diet, apart from diet, what are we so worried? Leave about diet, exercises. 50% of population in India is physically inactive. Isn't it alarming? This study was conducted among 14,222 individuals. And even more alarming is less than 20% of the population involved in regular recreational physical activities. Talking about smoking, India is the second largest consumer of tobacco. GATS2 report says that 28.6% of population consume tobacco. So though we are aware of smoking risks and hazards, which is caused, which includes from cancers to chronic diseases, including leukemia, till about kidney problems and cervical cancers, bladder cancers. So the sign which is onto the left side of this picture, it is being displayed in various public places. For example, when we go to a theater, so this signboard, it really, the person who's looking at this are aware that yes, smoking is risk, smoking causes hazard. So though there is so much of awareness in the public, various public places, there is something missing in this, which is causing a significant smoking hazard. Alcohol, talking about substance. So this is a study in 2010 ICD, which says that they studied about various forms of drugs, and also amongst this, to beat the race was alcohol, which causes more of self-harm and the harm to others, for scoring about 72%. We are all aware of alcohol and its issues. We face it during our regular practices. We spoke about studies which describe the risk factors, and now we come to the disease burden, of which the topmost leading diabetes. Over the past 2 decades, prevalence of diabetes has increased significantly. It is doubled in urban areas, it is quadrupled in rural areas. Roughly, the current estimate says that 70 million with no diabetes are in India, and which could increase to 100 million by 2030. What are these numbers what are these numbers trying to tell us? We will look into it shortly. The second leading cause, hypertension. India is an exception where the prevalence has gone up. 30% of Indian adults are hypertensive, expected to go from 118 million to 213 million by 2025. And I'm sure during our routine practice, we see a lot of patients who are undiagnosed or may be diagnosed on a routine screening. Talking about lipidemia, this study really shook me. Only 20% of the population in India has a normal lipid profile. So though there is so much of awareness, it is only accounting to less than 18%. So there is an increasing trend over time in terms of hyperlipidemia. And it's also shocking to see that the patients who are on treatment for lipidemia are 8%. So even in a very well-controlled patient, the number is only showing us less than 5%. So this is a table which was taken from Lipid Association of India in 2020. If you look at the treatment goals and the recommended drug therapy, it is quite alarming. The number says that very high risk LDL should be less than 50 and less than 80. will the drugs alone play a role in this, or there is something else we need to do about it? This diabetes, hypertension, hyperlipidemia, of course, leading to cardiovascular diseases. We know that 20% of deaths in India are due to cardiovascular disease. And in the cardiovascular disease group, ischemic heart disease and stroke make up to 83% of all in the cardiovascular disease in India. We see the chart display the difference in the statistics, especially the Indian and the global. This study is done comparing the Indian and the United States. This was published in Journal of American College of Cardiology. Of course, the biggest chunk we see today is obesity and overweight. In Indians, the obesity is growing rapidly. We see 20% trends increasing rapidly, and of which women, the obesity in women has been in rapid rise. It was expected to reach 50% by 2022. And I would like to pay attention, you to pay attention and the truncal obesity. So, which is very common in India. And why spare children? I think with the trend with online classes, and maybe in future, which is going to be like, maybe we don't know if it's going to be a norm in studies. I'm sure children with sedentary lifestyle, the pool is going to be added in the major pool, and the numbers are going to be increasing. As I mentioned, again, I would like to highlight the truncal obesity and the subcutaneous fat with the low muscle mass, which is compared to the Caucasians in the study, which is published in JAPI Feb 2009. So what is this, along with the associated death, there are studies which compared various parameters in terms of BMI and waist circumference. A couple of slides I would like to discuss on this. So if you see here, this study really gave me a shock when I studied for the first time. This is for the adult Asians, where the normal range was 18.5 to 22.5 was the BMI, and overweight is more than or equal to 33 opposed to 25 as we see. So quite a significant study which we see here. And also comparing the BMI categories and the risk of disease burden. So this was a study which compared between female and males, and it really showed a significant increase association between BMI and the risk of disease burden. There's another study, again, BMI with the cardiovascular disease. Yes, of course, we have come across several studies which compares the indicators, clinical indicators. Waist circumference, again, showing a risk of diabetes. So talking about risk factors and talking about the disease burden like diabetes, hypertension, cholesterol, cardiovascular disease, of course, depression. Depression currently in India is more than 10%, and it is alarmingly rising. And also we understand that there are many patients who are actually undiagnosed. So we also see various correlation between depression and cardiovascular disease, depression and unemployment, depression leading to a lot of substance abuse in terms of alcohol, drug use disorders, depression leading to social isolation. And of course, it is quite challenging to handle clinically. So socioeconomic stress, like in the first slide when I mentioned, there were a lot of challenges in health when it comes to health. One of the significant things is socioeconomic stress, where we know that there is an inequity in terms of access to healthcare, in terms of access to treatment. So this study mentions clearly that in a lower income groups, especially countries with the low and middle income countries, which is being burdened with the cardiovascular disease. So the study clearly says that there is an increased cardiovascular events. So, and this study says that social isolation, this talks about social isolation, so which is prevalent for about 20% among the elderly in India. So social isolation, though we are moved from a joint family culture to a nuclear family, where we understand that we are surrounded by people, there is a significant entity of loneliness, where the loneliness is giving rise to a lot of habits like smoking, alcohol, and we also see here there's a lot of issues even with the lifestyle. And loneliness is more dangerous than obesity, and it says that it is almost damaging in health as smoking like 15 cigarettes a day. So, talking about the risk and diseases, we understand, yes, as family physicians, we are doing our best. We are giving our best care to our patients. So, I felt the lifestyle medicine is a paradigm shift in looking at treatment modalities. And of course, going forward, definitely lifestyle medicine plays a huge role compared to conventional medicine, wherein we feel that patients are the passive recipients. I would like to highlight in lifestyle, this is going to be like the ball is in patient's court. So wherein the patient is made responsible for his or himself or herself, that lifestyle plays a significant role in reducing the exposure to the risk factors and also reducing the risk burden. Lifestyle medicine. There's a famous definition which says that it is an evidence-based approach to prevent, treat, and even reversing diseases by replacing unhealthy behaviors with positive ones, such as eating healthfully, being physically active, managing stress, avoiding risky substance abuse, adequate sleep, and having a strong support system. So lifestyle medicine, which is showing us so many components, and I would like to take each component eventually now. I would like to know if there are any questions at this point of time, and also I would like to address if there is any.
Dr. Shalini, I have a query.
Yes, Dr. Srividhya.
So you had described about the various risk factors and who are all at risk and who should we address when we meet in our clinic, when they come for various problems. It can be as simple as a common cold or tummy issues or any of those things. But if you look at this definition of lifestyle medicine, there are so many parameters are there. How do we incorporate in our regular practice? Because I'm sure majority see patients for maximum 15 to 20 minutes. And how do we incorporate all these things in this? Because this becomes a challenge. I'm sure many of us would like to do this, but how do we do this? I'm sure you might tell later in the session. I just thought I would.
That's a good question, Dr. Srividhya. Yes, of course, lifestyle medicine, as I mentioned earlier, it's a paradigm shift wherein we understand the time constraint. There is a slide on lifestyle medicine approach where there is a time constraint, and we also lack resources to evidence those support. So lifestyle medicine, yes, indeed takes a lot of time with patients. So first thing is to identify patients who are under risk factors and also in the disease burden group. Definitely during our routine practices, we see a lot of patients with multiple comorbidities, and we see variety of scenarios and studies. I will also be talking about those. So there are some places where there is a different approach wherein we can, like I mentioned, lifestyle talks more about self-care and self-management. It talks about self-care and self-management. So it is going to be like, it can't be a one-sided approach where the physician takes the entire burden, and lifestyle medicine makes it a point that it is two ways. So I hope that
yes.
Yeah. So a couple of disclaimers here before I display the slide. Healthcare is not about using lifestyle medicine versus other proven treatments. It's about collaborative evidence-guided approach in which conventional lifestyle medicine, complementary, and self-care complement each other. So I think it is very evident that it is not going to be a substitute of what we're doing. It's going to be a complementing thing to the services, and also for the better outcome of patient. So we came across slides which was showing an alarming numbers in terms of risks and disease burden. The scope of lifestyle medicine, I'm sure it is going to make a huge difference in patients' life, starting from diabetes, obesity, osteoarthritis, mental health. And also the study says that 80% of the problems which comes to the primary care physicians can be managed, as we are already doing it. It can be managed, and majority of which with the lifestyle component would do much better. So this is an interesting slide, and it's my personal slide of the talk today. A BMJ article, prevention and lifestyle therapies are the way forward. So I would like to read every word in this paragraph where it makes more sense. So medical education has focused on being the ambulance and at the bottom of the cliff rather than fence at the top. And our medical environment is still set up like this. Money talks, and there's very little money in promoting eating broccoli, or it could be any other greens, and going for a walk, despite them being much more effective. It says it. As we move on with this lifestyle medicine, the question which struck me was, do we incorporate lifestyle medicine in medical practice? So as I mentioned earlier, yes, we are aware of the risk factors. Yes, we are aware of the disease burden, and we saw the numbers are shooting drastically higher. So this was a study which was taken from American Journal of Lifestyle Medicine, where it says that physicians during their regular consultation, in terms of coming across obese patients, about 36% were advised to lose weight, and 28% of smokers were offered assistance to quit smoking. Of course, it was said that it is the main barriers were lack of time, knowledge, and resources. So like I mentioned earlier, the type of patients we see during, especially when I see my patients, the scenarios which I would like to give will highlight the significance of lifestyle. So here, this patient who was diagnosed hypertensive, and he was advised antihypertensives, and he was started on antihypertensive. Along with that, he was also advised diet modification and exercises. So the patient took it very strictly and started doing it as advised. But his concern when he came to me, doctor, I have been doing this everything, but looks like there is something which is not right. Could you give me more information on other things that I can do, as I don't want my situation to worsen or medication to be increased? Yes, we come across such patients where they don't want to increase the medicine. They just wanted some tips, rather I would put it like tips from us where they can improve. So here in this context, I can clearly see that the patient is highly motivated to do a lifestyle corrections. Of course, we need to address these opportunities where we can inculcate the lifestyle modifications. And the second scenario, which I'm going to talk, so he's a young guy, 19 years old guy who works in international airport as a desktop operator, where his shift times are haywire and his food habits are erratic. So he was observed by his mother as he was gaining tremendous weight. So he has gained about 85 kgs. Currently he's weighing 132 kgs, wherein he was 85 kilos a couple of years ago. So the mother was very concerned. She was like, such young guy and putting on so much weight. So it was a cause of concern. But when I spoke to him, the concern he had was, doctor, I like my job. I don't have time to do any exercise. Is there any pill which I can take and reduce my weight? So I see here, though he's aware of the risk, though he knows that the weight has increased and he's also prone for diseases, he knows everything, but still he doesn't want to do any lifestyle corrections. So I see that there's a lagging motivation in this patient. So before I step into any other treatment, I clearly see that this patient requires immense counseling. So maybe a couple of sessions to see his motivation levels and then take it forward. I do see a lot of patients who come to me saying with several other metabolic syndromes, polycystic ovarian disease, which is increasing, especially when they go to a gynecologist, of course, with irregular cycles and weight gain, the first thing the doctor would advise lifestyle corrections. When you go on the media platform, there are again number of information available on the platform where the patient is confused what to do. Rather, I would say skeptical whether this diet is okay or that diet is okay, whether I should do exercise like this, doctor, whether what should I do. So addressing the lifestyle concerns and telling the patient, addressing the and making them understand the concept where things are going wrong would definitely make a difference in their life. So moving with my slides. So the best way to deal with all these problems is, I would put it across saying 6 ways to take care of your health. So this picture has been taken from American College of Lifestyle Medicine, wherein they talk about 6 areas to improve health, especially in lifestyle medicine. So highlighting the features saying healthful eating and physical activity, managing your stress, managing your sleep, avoid risky substance, and also maintaining a positive relationship. I would be talking about it individually in my upcoming slides. This is a platter. Isn't it tempting? So I would say yes. So again, this is a picture which is taken from American College of Lifestyle Medicine, which recommends on eating plant-based predominantly on a variety of minimally processed vegetables, fruits, whole grains, legumes, nuts, and seeds. I'm sure post-COVID, I think people have realized that gut is something to something which is very relevant when it comes to disease. So here it clearly says that the food we consume is of significant importance. So talking about nutrition, I could go days talking about nutrition, and due to time constraint, I think I will limit my talk to a couple of things in nutrition, and I'm open for questions later. So nutrition, this is an important slide. As we all know what to eat more and what to limit, this is a slide which shows that what should be consumed in plenty, like I mentioned, vegetables, fruits, legumes. So when a patient is asking about diet, when a patient is talking about, doctor, what to eat, and so setting up a goal is the first step moving towards lifestyle corrections. And the key to setting up goal is a SMART technique. I would elaborate this abbreviation saying specific, measurable, accountable, and realistic and timely goals. Say, doctor, next 3 months, I'm going on no carb diet. I'm going, so on a long run, we need to explain to patients how it's going to disturb their routine, the health. So I would like to put across an example. Say, I will add 1 cup of berries to breakfast and a small apple or orange as an afternoon snack for at least 5 days this week. So it's very clear that the patient has set a goal which is achievable. This is just an example. You can make such simple goals. So rather than making a goal which is not sustainable, you could make a small goal which is sustainable and make sure that those goals are consistent and sustainable. So various diets in the literature, when we come across vegetarian diet, Mediterranean diet, DASH diet for our hypertensive, this slide talks about what is common in all those diets. So it talks about plant-based diet. So it says that whole grains, legumes, fruits, vegetables. These are the main constituents of any of the diet you take in, and keep your dairy, fish, poultry to a low or moderate consumption, and then you reduce or lower the intake of processed meat, refined carbs, sodium, and added sugar food. So it's very clearly evident that it is not a single diet which a person can follow. It is a sustainable diet on a long run to get the best benefit in terms of lifestyle.
Dr. Shalini?
Yes, Dr. Srividhya.
So the diet which you were describing, the various types of diets available, and they look quite nice to see with the colors and things. And we do read in all the papers about the different Mediterranean diets you can try, DASH diet and things. But how practical it is to incorporate in our regular Indian food? Because if you look at the whole grains or the legumes or things, yes, we have our dals and rice and things, but is it practical to put it on a regular basis? Because at the end of the day, we want our patients to follow this for next 30, 40 years. So what would be your advice on what type of Indian diet which can be used and their regular food?
Thanks for that question, Dr. Srividhya. So diet, when it comes to diet, it is not a single day task. First, we need to make the patient understand that it's a long-term goal and it's not a short-term goal. Second thing is, we also have to make them understand that the diet culture, which has changed now, could be westernization, because I would attribute to westernization, or maybe and also it is good to tailor make things to your patient. Of course, I cannot say tell patients berries are good, and I cannot tell patients yes, whole grain is good. As we all, as a family physician, as we know our patients well, we can make as a wholesome, cost effective, and tell them that to take a baby step in terms of modifications. So we all, as we see in this slide, the commonest being plant-based. So the reason why I'm talking about this, there is various literature saying that talking about dairy, talking about red meat. I would like to go into depth of that a little later, but then it clearly says that there's a huge role, at least to make a small change in the diet. Say, for example, when a patient comes to you, you could encourage them taking about 4 to 5 servings of vegetables or fruits per day. It could be anything, and as I would say, it's a seasonal fruits, or because I'm sure like mango is available throughout the year, but that's not seasonal. So make them understand that yes, introducing fibers to your diet is very, very important in terms of disease management. So we could say that for a week, why don't you try changing your diet? When the patient, of course, when the patient comes back to you, you can even tell them, yes, that's a great thing. So the in lifestyle, it is about constant check on your patient, how motivated they are throughout your advices, and how well they are adhering to the tips you give them. So on a long run, once they are onto that board, I think things are taken care. But then till you get them, like tell them, say for example, a person who is eating meat, I do encounter the patient saying, doc, you tell me to do whatever you want, but I don't want to cut down on my meat. So like I mentioned earlier, meat, there is a tremendous increase in production as well as consumption. And I also mentioned that there is a significant role in the method of preparation. So when I talk about that, and I'm also keeping in mind that there is a association in eating meat and the inflammatory process which is happening in the body, wherein I put across it to the patient saying that, yes, this could be one of the things. Why don't you, I cannot say, tell a patient, completely stop meat, completely diet. That is not the solution. And of course, patient will and we should also understand that our patients who come to us, they're not coming to us for the first time listening to all this. They would have done n number of research on this, and they are coming to you. So,
Dr. Shalini, there are a couple of questions on diet.
yes.
There is a question about what is inflammatory substances in the diet and what about microbiome?
All right, that's an interesting question. So talking about diet, so lifestyle talks about a lot of gut immunity. So it is all interlinked. So they say that gut, we are aware of the central clock and the peripheral clock. So we talk about a lot of issues with the circadian rhythm. So when we talk about the central clock, which is basically your suprachiasmatic nucleus, which is situated on the the junction between your optic nerves. So that is the stimulus for that signal is it could be a light, it is a light signal. So the same way as the central, the circadian rhythm is set, there is also a peripheral clock, which is like your liver has a clock, your gut has a clock, and every tissues in your body has its own clock. So talking about gut per se, so suppose a person eating meat. So there is something like when you consume meat or fat for that matter, so what happens is that it increases your oxidative stress levels, and in turn, your pro-inflammatory markers are increased, and then causing into the whole vicious cycles of chronic inflammation. When you're talking about lifestyle, the main goal should be reducing this chronic inflammatory conditions, which was actually would have started much with the lifestyle issues, but the disease comes later. So a person whose lifestyle issues are triggered in terms of irregular meal patterns, irregular sleep patterns, this clock, circadian rhythm, and the peripheral clocks are imbalanced. So the same way when you are taking, for example, if a person is consuming a snack at 10 a.m. and a person is consuming the same snack at 11 p.m. in the night, so the person who's consuming at 10 a.m. is the thermogenic effect of the food, or the fat burning capacity of the food is 6% more than the person who's taking the same snack at 11 p.m. So our bodies sync to several clocks. So of course, when we have, like the same way, when a night shift person is having a snack, say around 10 p.m. or 2 a.m. in the morning, there is a study which says that the fat accumulation in the gut, that is what they talk about leaky gut, where your microbiome is disturbed completely. So it is better to have a proper scheduled food pattern rather than having an erratic pattern of eating. This relation is spoken even much before during the Hippocrates period, where the association between the regular meal pattern was studied. So this chronic inflammation triggers could be your high fatty foods, saturated foods like your meat, including your bakery products. It could be your any processed version of the food will trigger the inflammatory chain reactions. I hope that is okay.
Thank you, Dr. Shalini.
Yes. Any other questions? I would like to take it.
There is another question on diet. What's your comment on adding commercially available probiotics like yogurts in daily diet? Do they have a beneficial effect?
That's a good question again. So when it comes to diet, we know the benefits of adding dietary fibers. So our fibers mainly, say if a person is going on no carb diet, so our fibers. I'm sorry about that.
I did. It's muted,
Okay.
Shalini. You carry on.
Okay, all right. Sorry for that. So yeah, when we talk about diet, so dietary fibers have been spoken high. So we have seen the risk burden being reduced from cardiovascular disease to even cancerous conditions. So I would say anything which comes to diet, we need to choose substances which are less handled by man or a machine. So I think probiotics, I would say even, adding a simple curd. So I did talk about the low to moderate intake of dairy products, but it is not completely off. You don't have to really take it off from your diet. So we do supplement in patients where the gut flora has been disturbed in terms of post antibiotics, just to regain that flora. So of course, maintaining this microbiome in the thing is not a single day task. So I eat a probiotic today, and I'm not going to be. It's not like it's a single day task. So.
Thank you, Dr. Shalini. We can move on to our next pillar. Yeah.
Next, yes. So a couple of evidences in nutrition, again, which talks about Mediterranean diet and the coronary artery disease prevention. And these are studies where you can look into where there's a strong evidence about diet and disease burden. And another couple of studies where there is a significant study showing a plant-based diet with a low fat along with the psychosocial support. So like all the components which I was talking earlier, everything is being addressed, and definitely there is a significant difference when all the components of lifestyle are combined together, not single component alone. Moving to exercises. So like I mentioned, the studies which said that less than 20% of people are actually, less than 50% in Indian population exercise. So it is quite significant. Of course, it is quite tricky when it comes to exercises because of various things. Maybe the fitness levels are different from each other, and what to do, what sort of exercise to do, what not to do. Again, the tailor making the prescriptions. We do write exercise prescription for patients. Tailor making these prescriptions for the patient will make a huge difference. So the guideline says that 18 to 64 years old adults should at least do 150 to 300 minutes of moderate intensity or 75 to 150 minutes of vigorous intensity activity weekly, along with 2 or more days weekly of strength training. Yes, so at this point, I would like to address about strength training. So strength training, or we call it as resistance training, which is very, very crucial. It so talks about like as we age, there is significant reduction in our metabolism by 2% every decade. So if I want to have a good metabolism, then I need to build up on my muscles. So as Indians, we also have we are prone for sarcopenia as our age advances. So losing your muscle mass will be of a big challenge. So strength training, resistance training on a longer run definitely improves your endurance, definitely improves your balance. And of course, yes, when I'm aging, I want to be fit. So in order to achieve that level of fitness, we got to do something right from the beginning. And of course, all the components of exercise, we talk about aerobic and we talk about resistance training exercise, the flexibility exercise, and balance activities. So I would like to take up any questions if there is anything about the exercise as well.
There is a question about strength training in teenagers under 18. Since we do see patients, especially girls overweight or obese under 18 years of age, I think this would also address our query on PCOS, Shalini.
Yes. So like I said, exercise, yes, exercise and diet goes hand in hand. We cannot say that Diet, yes, I am eating a whole food plant-based diet, and I am cutting down on all the processed food, and I'm also eating on time. So I need not do exercise. That cannot be a choice. So exercise and diet goes hand in hand. The strength training, the reason why I was talking, I'm sure the minute the younger generation, as soon as they are clearing up with their graduation, and when they are into their jobs, it is going to be a desk job. So I would also like to tell you at this point of time, exercise is different from physical activity. What we talk about exercise, so like I mentioned, if the ITs and the predominantly now there are a lot of sedentary desk jobs. So in all these people, the commonest thing will be when they come to me, when they tell me, doctor, I did exercise in the morning, but throughout the day, I'm stuck with my work. So at this point of time, I would like to highlight the things that exercise, yes, you need to do. Apart from that, you need to be moving. So the physical activity component is very, very important. Like they say, every 20 to 30 minutes, you got to get up from your desk and do some activity wherein you keep the metabolism. So the youngsters who are just into all the sedentary profile need to be highlighted on the strength training. And of course, I think earlier days, even in teenagers, kids used to play like so many sports, but I think because of various lifestyle change, the more of the sedentary profile has been predominating. So the strength training plays a huge role in even to avoid the disease burden later in future for a teenager.
Thank you, Dr. Shalini. We can move on. Yeah.
So this is a Lancet study and also WHO guidelines on physical activity, 150 minutes per week, as I mentioned, of moderate intensity. Some physical activity is better than none. So the sedentary behavior has to be broken. So it is overall emphasis on active living. Yes, as we say, life moves on, but I would say, please keep moving. Talking about our stress. Yes, how can I quantify this? Stress is unavoidable. I know that. So even our patients tell that I'm quite stressed. And we also tell patients, why don't you consider doing something about your stress? I know your sugars are shooting high. Your hypertensive is not under control. So we need to understand that what is that distress? Or what is that short or long-term anxiety we are addressing in this person? So yes, stress is helpful for some tasks, like if I'm sitting for an exam, or if I'm like now I'm talking to people. So this stress will definitely be of help for me to concentrate and to be alert. But the negative stress, distress, of course, it is going to push us in a lot of mental and physical health. Stress varies from person to person. It could be the same trigger, but the way the person is looking at the stress can vary. Why can't I see the stress differently? Can this trigger be looked at in a different angle is what we're going to highlight. What are the positives in this patient? What are the negatives in this patient? Is there any other way we can focus? And is there a way where we can focus on what is going on well in life? Focus on accomplishment. So even in stress, there are goal setting. So again, it's the same SMART technique. So we are going to be very specific in terms of positive stress management goals. So for example, I will write about what I'm thankful for at least 10 minutes, 3 times per week. Yes, it leaves me thinking. Yes, so I am trying to move away from the distress mode to the a positive mode where I can look at things better, my performance can improve, and my concentration ability can improve.
Dr. Shalini, we have about five to 10 minutes to finish your slide so that we can take some questions.
All right. So
Thanks.
there is a strong, thanks, Dr. Srividhya. There's a strong evidence on mind-body medicine. Yes, it is a healing. It is mentioned in the studies. There are quite a lot of studies which talk about that. So, for example, yoga, it is actually considered to be a psychoimmunological type of treatment in patients where there's positive results in anxiety, fibromyalgia. We do see so many patients with fibromyalgia, hypertension, heart disease, and breast cancer. Coming to sleep, I hope all of you are awake with me. So sleep, I know there is quite a lot of studies on sleep and better health, but I feel there's a lot of things lacking in understanding the importance of sleep. So the recommendation for adults in sleep, anything less than 6 or more than 9 hours is going to definitely have a lot of issues in terms of our day-to-day activities. If there is a beautiful concept when it comes to sleep, time permits, I would like to discuss it later. Social connections and relationship, of course, they say that in the lifestyle studies, they say that short positive social interactions can even improve blood pressure and heart rate. So strengthened social connection is one of the components which is highlighted in the lifestyle studies, wherein it brings a lot of decrease in our, brings a lot of physical, mental, and emotional strength, which could be an important predictor of human happiness and long life, which is saying a positive, strong connections. And I also, in relation to the social relationship, I would like to read the slide saying that lower risk of mental and physical condition reduce mortality risk. So definitely, the social relationships plays a huge role. Like I mentioned, the loneliness being so predominant, of course, this could really make a huge difference in terms of longevity as well. So avoidance of risky substance. We know that loneliness can give rise to several other substance and other high-risk behaviors. So smoking, one of the significant risk factors leading to a number of health issues. There is a way we can handle patients with risky substance use in terms of alcohol and smoking. So there are guidelines which is put forth by National Institute of Health, where talking about the normal drinks. Of course, this is a US-based cutoffs, and I'm sure together talking about all the components of lifestyle, we can ensure that majority of your 80% of premature deaths are mainly due to the unhealthy diet, lack of physical activity, and smoking. Adding to that, we have the mental health conditions. It's an important study, again, from American College of Lifestyle Medicine. So these are significant studies wherein we ultimately, it is summarizing saying that tobacco, poor diet, lack of physical activity, stress, and alcohol, again, as we discussed earlier. So in our routine practice, just for a quick reference, I have put a small questionnaire where you can screen for patients having lifestyle issues in terms of sleep, nutrition, exercise, and also smoking, and how we spoke about the motivation in patients. So we clearly now see that there is an evidence for lifestyle medicine in terms of wide range of diseases. This is interesting slide which talks about centenarians. So yes, individual places mentioned here has its own specific, lot of studies and research has gone into this. What is the commonest thing in this people? So centenarians are the people who are living more than 100 years. So moving naturally, which was one of the significant component in terms of longevity, and healthy eating habits, like I mentioned. Again, it says that they concentrated on whole food, plant-based diet and they did avoid the processed food. And also close relationship, again, positive connections, friends, family do matter. This is an interesting article about Mauritius, who was a Greek war veteran who was diagnosed with lung cancer. I would leave this slide for you to read this article. It's a beautiful article written wherein when he suffered with lung cancer and what happened next. And I would like you to read on this article, very interesting one. So most important slide of my presentation, refer less, resolve more. As family physicians, I think we have a huge role in discussing with our leaders and public health policy making, decision-making policy, wherein I know that there's a significant role for us to play in terms of disease management, risk reduction, and also reducing the disease burden and also avoiding complications which will end up patient being in tertiary care centers. So we need to flip this pyramid in order to get better health outcome. I have dropped few links for further references in terms of lifestyle medicine. And I would like to thank AFPI for this opportunity. Happy to take up any questions.
Shalini, there are queries about, can you share the self-questionnaire form, the assessment form which you had shared?
Yes, definitely. This is again, I've taken it from American College of Lifestyle Medicine. Of course, in our busy schedule, just screening them and knowing them, are they into the lifestyle risk? Would definitely, we can buy some time, we can even follow up on their regular consultations, and also every consultation we can make use of the opportunity to address the lifestyle issue. It is going to be talking about the importance of the lifestyle issues again and again. As I said, patients need to understand that it is their responsibility as well.
I think Dr. Kishore had some comments to make. Dr. Kishore, are you there?
Yes, sir.
Yes, sir. Good evening to everyone and good morning to some of you. Am I audible?
Loud and clear.
Yes, Dr. Kishore. Yeah.
I think excellent session, a great session, and compliments to Shalini ji. I'm really
Thank you,
impressed.
sir. Thank you. Thank you,
your
sir.
knowledge and the way you covered it. Fantastic.
I hope I
Hats
did
off
some
to you.
justice to the lifestyle medicine, because lifestyle medicine is a huge subject, and I hope I made some justice to this.
It was
My
superb.
talk.
See,
Yeah,
I'll
thank you,
give
sir.
you my comments. I'm in this field for more than 35 years. I'm 60 years old.
Oh,
And
lovely,
I
nice.
work for corporates, and wellness has been my subject.
Yes,
Nobody
sir.
has compiled so well with all the references. Hats off to you.
Thank you,
This
sir.
is
Thank you
actually
so much.
this is being watched by 3% of AFPI members. Very poor attendance. So the thing is, how we go ahead. Today there was a meeting of Wonka, and
Okay,
they
sir.
have a platform for Zoom sharing. They said they can give it to us. I will
Okay,
suggest
sir.
to Dr. Kamlesh Bhargavaji, this we should have again, so that
Ji.
more
Yes.
people get benefit, and we can have it globally. Okay.
Ji.
And when we have it globally, our Indian AFPI members will definitely come, because we are doing it globally. There is something in it, they'll definitely attract them. Believe me, this is the future. This is the future of primary healthcare. And
Yes.
after doing this lifestyle assessment form, ma'am, you've shown page 1. Can we see the page 2?
Yes, yes, sir.
There's a wellness index or a wellness quotient that needs to be created. And that wellness quotient can help an individual to follow himself. It can help a corporate
Yes.
organization to look
Yes.
after the corporates, where they need to concentrate, where they need to put their interventions. It's
True.
so very important. There
Yes,
was
sir.
another
And it's a
thing.
long-term project, sir.
It's a long-term thing. That's a challenge.
Yes.
Other
Yes.
thing in your definition, I would like to add
Yes.
something. I found it a bit incomplete. We need to
Okay.
add occupational health and ergonomics in it. You mentioned
Yes.
that, people working on corporate,
Yes.
computers, they are not moving. Well, they need to move.
Yes, sir.
And
So I
that part we
actually
need to
squeeze
add.
that part into exercise.
No issue,
and,
no issue. I'm just giving my comments.
Sure,
Okay.
sure. Yes,
So,
I take that.
there,
Yes, sir.
exercise on the desk, just standing and working will make you burn 150 calories an hour. So these
Yes.
things we need to share. The
Yes, sir.
other thing is that somebody said, how to, talk to our patients in such a short time. Well, what I've done, I've got a 300 square feet clinic. I've designed it in such a way that I can do talks for my patients. 30 patients can attend. I can do it on a separate day, on a weekend, and,
Yes.
focus on these lifestyle,
It's a group
problems.
consultation, sir. It's a group
Yeah, and then
consultation,
they can
quite
come.
familiar, and yes.
And then you can have a smoking cessation program. You can
Yes.
have a, 10 kg weight loss program. There's a different avenues for a GP to, become better. Other thing
It's
I
a
would like to add, today there are many lifestyle modification devices. We've got these smartwatches. Apple's is 40,000.
Yes.
We have one in India called as Goki. It's only 5,500. And
Yes.
there, all the parameters, weight, diet, everything can be tracked. So lifestyle modification can be aided by these lifestyle modification buddies, which cost only 5,500 rupees. And
Yes.
the advantage in COVID-19, it is measuring oxygen saturation, temperature, pulse, blood pressure, everything. 5,500. And it is accurate because I've done studies on it. And we are thinking of, promoting in an AFPI also. So, what you need is a lifestyle modification buddy. So these are my few comments that, and I'm very happy that you have done this. And the only thing is there's less people who attended. We should have it again. So good
Sure.
webinars we should have again. My sincere suggestion. These are my few suggestions to you. Thank you for
so
giving
much.
me the
Dr.
time.
Kishore. Thank you for your wonderful
Thank you
comment.
so much, sir. Thank you, sir. So, Dr. Srividhya, if there is any other questions, can I take it?
I think we have addressed majority of the questions. I think there is one question. Yeah, it's all done. Yeah.
Right.
Let me have a look. Dr. Swapna has commented there are people who do not lose weight at all in spite of good compliance to all parameters. How do you advise them and motivate?
Okay, so in people who are not losing weight, there's something to talk about insulin sensitivity. So there is something called as advanced glycation end products, which are, even when we are eating, we do have this advanced glycation end products. Basically, these are glucotoxins, and this is actually increased in food which are highly processed. So an individual who is like, say, if I say whole food plant-based diet, it doesn't mean a French fry where it's actually a plant-based, but then you're processing in terms of, deep fry and things like that. So what they tell that the advanced glycation end product actually decreases the insulin sensitivity. So we see this in terms of like being a patient. So moving towards the insulin resistant, though there is an insulin production, but the sensitivity has become very low. So the highlighting things like diet is very, very important, accompanied by the strength or resistant training, wherein we are looking at the metabolism at, we all are aware of the intramyocellular fat, which is causing insulin resistance. So it could be a component of both either insulin sensitivity being lesser or insulin sensitive plus sensitivity being lower, plus insulin resistant being on higher side. So this is where the issue comes, where in spite of patient doing regular exercise and diet, of course, the weight reduction will be very less. And also we should look into their diet pattern. Are they, the best time to have your meal is break your fast at least by they say 6:30 or 7, and then you have your lunch by say 1 o'clock, and your dinner by say 6:30. I'm pretty sure it's quite tough, but then
right. Dr. Shalini, there was another question on what's the relationship between cancer and malnutrition.
Oh, that's
Briefly,
a double-edged sword. That's a very good question. It's a double-edged sword. So cancer, again, this is about the chronic inflammatory conditions which we leave it for a long time. The chronic inflammatory conditions could be resulting because of the irregular food habits. Sleep can have a significant, as we all know, that sleep has a sort of repair mechanism during when we have a good quality sleep. There is a lot put into the DNA repair and things, where the study says that when you're not having a good sleep pattern, of course, there is a damage which occurs at the DNA level, which could be contributing for your malignancy. And the malnutrition, when we cut down on too many, like say the various diet I was talking about. So if you're you need energy like a carbohydrate, your macronutrients like your carbohydrates, proteins, and fats in optimum level. So instead of being I like this food and I like this, I like to eat, if we spread across, basically diet requires a lot of planning, and a planner will be of a good help to plan your meals.
Thank you.
I would like to add one thing out here, Dr.
Yes,
Madhwani. It's basically food rich in antioxidants, that's what is important. Am I right? So we need to have antioxidant food more in our diet to prevent cancer. That's very important. Yes. And one more, I think I've intervened. I'd like to add one more thing, is that this is for Shalini and for all the participants.
Yes, sir.
All the studies you saw, they are abroad. Indian studies are not there. The parameters you used for obesity were Indian. Studies are all abroad. I strongly recommend all of you, Shalini, you must take the lead. Start preparing for an excellent paper. Let us start working. Let us share our experiences. Make it structured. Make one study from AFPI. We have a journal. Let us come and make one of our studies on this. This is the future. So just, food of thought.
Shalini, there is a question also. Is there a transient period of no weight loss in spite of total involvement in weight loss regime? Is it inversely related to weight?
I didn't get the question.
There is a question from Dr. Soumya. The question is there a transient period of no weight loss in spite of total involvement in weight loss regime?
Yes. So the basic thing how a body understands things is it tries to conserve the nutrients and energy, basically trying to have the reserves for for wine and things. That's how the body built is. So initially the patient might not lose weight unless and until we put the patient on the regular mode of dietary changes and exercises, wherein we don't see initial weight reduction, but eventually we do notice that the weight reduction occurs. So we may not be able to fix the duration where the weight loss can occur or may not occur.
I think if anybody has a question, they can raise their hand and unmute their mic and ask also, if we have missed any questions.
We have overpassed our time. If any more questions are there, please put it in the AFPI members group. Shalini and myself will pick up the questions and we can.
Right. I do understand, Dr. Vidya. It's past your bedtime. So we should end this session as soon as possible. Okay. Right. So on behalf of AFPI, I would like to thank Dr. Vidya for moderating this session and Dr. Shalini for conducting this session. Parting thing which I would say is that any patient or anybody whom you want to advise or who comes to you for advice, begin with why. Why do you want to do it? And make sure that you have asked it a couple of times, they write it down why they want to do it. Maybe it's a girl whose marriage is coming up. She wants to lose weight. Or somebody's uncle's friend has had a heart attack and he wants to lose weight. Or somebody knows of somebody whose leg has been amputated because of diabetes. Some shocking things. Begin with why. Okay. Thank you very much, Dr. Shalini. And
thank you, sir. Thank you so much. Thank you once again.
Thank you.
Thank you, Dr. Shalini. Very, very informative session. Thanks.
Thank you. Thank you.